Hi, this is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas. And this is Daryl. Daryl just moved to Houston from Michigan, and he has been recently diagnosed by an orthopedic surgeon with multiple herniated discs in the lumbar spine. You said L1 through L4, right?
Yes,
L5.
sir.
And he's had low back pain, severe muscle spasm, and pain shooting all the way down into his left leg and all the way into his feet, which is called lumbosacral radiculopathy. And he has numbness and tingling specifically in his left big toe, which tells me it's the L5 nerve that's being affected the most. So y'all have been wanting to see an examination, so we're going to show you an intermediate examination on a patient with herniated disc. So let's go ahead and take your hands out of your pockets for a second. I'm going to have you close your eyes now, Daryl. Just let your arms rest at your sides. Flex your head forward and then backwards for me, please, sir. And then back to neutral. There you go. So your head's a little forward and to the right of center. You a side sleeper most of the time? Yeah. I can usually tell how someone sleeps just from their posture. And you also rotate it a little bit too to the right. Okay, so you can open your eyes, take a look. See, you have less space here than you do over here, so your pelvis has translated to the right on the x-axis. Your head is forward in the z-axis. Your ear's dropping right here in front of your clavicle. It's actually supposed to be back here over your shoulder. That's why your shoulders are turning around forward a little bit. See how this hand's way behind this one?
Yeah.
So that's the rotation in your spine. So first thing we're going to do is a lumbar range of motion on him. So I want you to bend over like you're going to touch your toes and tell me when it starts hurting.
Right there.
Okay, so he's at about 30 degrees flexion, and he's already got pain in his lumbar spine. Is it all through here?
Yeah.
Okay, now come up. Does it hurt coming back up?
Yes, sir.
Okay, so he's got pain upon coming back up. Now go backwards and tell me if this hurts.
Right there.
Okay, he's got sharp pain at about 10 degrees of extension. Okay, now I'm going to have you tilt left for me. Does that cause pain down there?
Right there.
Okay, so he's at about 45 degrees left lateral flexion. Now tilt right. He's got more range of motion in right lateral flexion. So, okay, does it hurt coming back up at all?
Yeah.
Okay, how about when you twist left? Does that cause any low back pain?
Mm-mm.
You got full range of motion and rotation to the left without pain. And you got pain at the end of the range of motion to the right. Full range of motion. Okay, so y'all wanted to see an orthopedic neurological examination on a patient with herniated disc, so here it comes. I'm going to have you lay on your back for me now, Daryl, with your head up here, legs down there. Yeah, zipper on that one. Okay, so this is called a straight leg raise test. I'm going to have his foot in plantar flexion on this right side. We're going to elevate his leg. Daryl, besides the tightness in your hamstring, tell me if this causes any lower back pain or shooting.
Right there.
Right, lower back or
Yeah,
leg?
lower back.
Okay, so that is a positive straight leg raise at about 70 degrees on the right side. Okay, does it feel better down here?
Yeah.
Less pain?
Yes, sir.
Does this cause pain in your back or your leg?
No,
You
sir.
relax your toes. Anything there?
Just aggravates
Aggravates what?
the back.
Okay, that's a positive braggart sign. We're going to cross that leg there. I'm going to push down here. You tell me if you feel any pain in your hip or your back.
No, sir.
Okay, that's a negative Fabry-Patrick test. That's usually a hip pathology test. So again, we're going to flex his leg forward. Now this is his bad leg, remember, so tell me when this starts hurting in your
Right
back. Does it go down your leg?
Yeah, all the way back.
All the way
to
down?
Yeah.
Okay, so he's got a positive straight leg raise test on the left at about 45 degrees with not only low back pain, but shooting leg pain. Okay, relax this now. Does it feel better down here?
Yes, sir.
Does this cause any of that same back pain or leg pain?
Yes, sir, in the back.
Okay, so that's a positive Braggart's test on the left as well. Now I'm gonna push down here. Is this hurting your
Yes,
hip
sir.
or your back?
It
Which
hurts
one?
the back.
The back, okay. So that's technically not a positive Fabry-Patrick because Fabry-Patrick is for the hip joint itself, but I also use it to identify whether it's the lumbar spine or the SI joint, and his was in lumbar spine. Now we're going to do a strength test on him, on his lower extremities. So I'm going to have you flex, push against me, pull up, turn in against me, turn out against me, push with your big toe, pull up with your big toe. Okay, now push hard, pull up, turn in, turn out, push big toe, pull up big toe. This side's a lot weaker. Did you feel the difference?
Yeah.
So he does have loss of strength also in the left leg. Okay, I'm gonna lift your head up now. Does this cause pain anywhere in your spine?
In the lower back.
In the lower back. Okay, that's a positive Soto Hall test. Let's sit you up and face this way towards Joseph, please. And there we go. Here, I'll take your glasses and put those right over here for you.
Thanks, sir.
Okay, so, Daryl, I'm going to do some tests here now. I'm going to push straight down. You tell me if this hurts anywhere.
Yeah, the lower back.
Okay, that's a maximum foramina compression test in the neutral position, which creates increased lower back pain, so that shows he does have compression in his lower back area. Now I'm going to go backwards and to the right and down. Does that cause any pain anywhere?
Yes, sir.
No?
Yeah, right here.
Okay, in the lower back as well? And how about when we go to the left and down?
Not as much.
Not as bad?
Mm-mm.
Now that's more of a test for cervical IVF encroachment, intervertebral foraminal encroachment. Let's just tilt your head this way. Does that cause any tightness or pain in your neck or shoulder?
No, sir.
How about when I do this?
No, sir.
Okay, tilt left. Does that cause any pain in your neck or your trap?
No, sir.
How about when I do this?
No, sir.
Okay, here's a real important question. Does this feel better, same, or worse to your spine?
Better.
Okay, I knew it would. That's compression. Okay, I'm gonna push down, you resist. Okay, that's a distraction test, and that was positive because it relieved his pain. I'm gonna push down, resist. He's got good strength in his deltoids. I'm gonna check his biceps now. I'm gonna pull out, resist. Now I'm gonna push in, resist. Good. I'm gonna pull out, resist. Now I'm gonna push in and resist. Biceps and triceps and deltoids all normal strength. Now, push against my hand. Okay, push against my hand. Okay, pull back against my hand. And pull back against my hand. This is a lot weaker there. Okay, did you feel the difference from side to side? Okay, just relax your arm in my hand here. Biceps is fine. Brachioradialis is fine. Triceps is fine. Oop, there's a problem. Just relax this for me. There we go. We like to have fun in here too. There we go. Now your left reflexes weren't as good as your right ones. Just let your legs hang. Got a little bit of a reflex on the right patellar and a loss of the left patellar reflex in comparison. Feel that one jump a little bit, and that one just barely does anything. So relax your foot. Let me hold it. This is the Achilles reflex. Just relax this foot. Okay, a very little reflex on that as well. So let's have you lie on your stomach now. And we're going to put your face all the way up in this face paper here. I'm going to examine his spine now from his feet all the way up to his skull. Now in this position, his right leg is short by 1/2 inch. When I bring his legs up, I bet you $1 zillion that tightens up in your low back and your thighs. Does it?
Yes, sir.
Yeah, and see his leg gets even, so that's a positive Knockless test in Deerfield. The Knockless test is pelvis raised up, lumbar spine raised up off the table. And he does have some involvement of the left SI joint. That's probably a little tender right there, isn't it?
Yes, sir.
More so than this one?
Oh, yeah.
Yep. So he's got some left SI joint involvement. And right there is L5. That's really tender. These are all tender, aren't they?
Mm-hmm.
Yep. So he's got spinous process pain and bilateral muscle spasm in the thoracolumbar and lumbar spine region, lumbosacral spine region. I'm going to have you lock your right leg straight and lift your whole right leg off the table. Yep, that's good. Did that hurt to do that?
No.
Okay, back down. Now let's try the same thing on the left one. I bet you this one don't go near as high. Yep, locks up right there, doesn't it?
Yes, sir.
Yep, see how this one didn't come up off the table? He has a sacral deviation test also to the left. That's probably tender right there too.
Yes, sir.
That's the sacrum. This is a palpatory examination. That's tender right there too.
Mm-hmm.
Feel that?
Yeah.
All these guys are sore. You got really tight muscles in here. That's the area I was talking about in that thoracolumbar area. You get tight shoulders a lot too, don't you?
Yes, sir.
Yep. And your neck's out right there. Even though he's not having a lot of neck pain, he does have subluxations in his cervical spine. Now he's had MRIs done already, so we're not going to have to reorder those. See 3 and 4 is out right there on the left. Do you feel that?
Yeah.
And a lot of times your headaches start right here, don't they? At the
Yes,
base of your
they
skull.
do.
Yep. So he's got an atlas and occiput subluxation on the right. T5, 6, and 7 are subluxated. And he's got thoracolumbar muscle spasm all the way down to the sacrum bilaterally, but it's worse on the left. He's got left sacral deviation and left SI joint subluxation. Okay, so you ready to feel better?
Yes, sir.
He has come here because he doesn't want to have back surgery. So we're going to adjust his spine for herniated disc. Right now I'm adjusting his right SI joint. Now I'm on the left SI joint. And we'll do pre and post test here to show you the difference too. And then the sacrum on the left. Hit that twice. Sacrum in the center. Now I'm going to get on L5, straight P to A. He's going to be a little sore here at first, but they'll feel a lot better when I get done. There we go. That was the most sore, wasn't it?
Mm-hmm.
That one too. There we go. There we go. It's a lot deeper than it looks on YouTube, isn't it?
Yeah.
Okay, just relax. There you go. And just keep relaxing. Perfect. That's it. Good job breathing. Good. Okay. Still think I got one right here at this lower thoracic. That's it. Yep. Okay, let me recheck your leg length here, which is even now. This should feel a little bit easier than that first time.
It sure does.
Yep. Okay, I'm going to have you lock your right leg straight and lift your right leg off the table. Okay, so we see how far that comes up, about a foot. Now this left one. Now that's better than the first one. That's getting close to the other one. That didn't hurt as much either, did it?
No, sir.
So his sacral deviation test is less down on that right side or left side here. So that shows we did realign his sacrum in the center of his pelvis. Now I'm going to put this curve back in his cervical spine. There we go. Okay, let's turn you on your back now. Now you know what I'm going to do to you next, don't you?
I think so.
The ring dinger, decompression.
Oh.
That's what's going to set you free. All that compression on your disc down there in the lumbar spine is going to be decompressed. Slide down this way just a little bit for me if you would. There you go. There. There we go. Good. Now let's slide down this way for me a little bit more. And put your arms straight out to the sides for me, please, sir. see, I think it's important to adjust everything on an individual so that their spine and their rib cage is lined up anteriorly and posteriorly. Now you should have felt that in your knee all the way up into your back.
Yes, sir.
Okay? Same here, just relax and breathe. Nope, let this one go. There we go, better. Okay. Now, let's sit you up, face toward Joseph again. Alright, we have this arm. Look, keep your chin up. That's the big thing I'm seeing already is you drop that head forward a lot. That increases the weight bearing all the way down your spine. So you want to keep your chin, head up and back. Yep, like that right there. Okay, just relax this. There we go, good. Okay. Good. Okay. Good. Yep, okay, now let's stand up here in front of the mirror for just a second again. Now, just doing that part of the adjustment, I want to see how much more you can bend forward.
Okay.
Go ahead and bend forward and tell me when it starts hurting.
Right there.
Yeah, but that's better than before. Good. Does that feel a little less pain than it did first time?
Yeah.
Okay, good. So we're going to have you lay on your back on this table with your pelvis right here, head up this way. Now this will be Daryl's very first time of getting his spine decompressed. There we go. Now let's slide down this way just a little bit. You know, many of the patients who come here in severe pain from herniated disc, they've already been to see an orthopedic surgeon or a neurosurgeon and have been told that they need to have spine surgery. And a lot of people want to avoid that at all costs. And if we can help them conservatively avoid that, we do our very best to do that, and oftentimes we can do that. Let your legs relax and bend. There you go. This is how you should start sleeping, by the way, is on your back. Let your leg relax. See, with your legs up like that, it should relax your low back muscles a little bit more. Okay. So I'm going to get this towel up under your skull here and your chin. I'm going to have you take a nice deep breath in. Exhale. Keep your teeth together. Oh, yeah. Did you feel that all the way down?
Yeah.
Okay. Deep breath. There. Okay. Now look, he's got a little bit more of a reflex on his right patellar, and he's actually got a little bit of reflex on the left patellar right now. It's not quite as good as the right one, but at least it's something. So we're going to adjust his cervical spine now with the Palmer diversified rotary brake. Oh yeah. Yes, sir. Very good. That should help take some of that pinching off that L5 nerve that goes down to cause the numbness in your left big toe. So let's have you stand up here in front of the mirror again. Let's get up sideways. Let me help you up sideways. There you go. And let's stand right here again. I'm going to have you facing the mirror. And I'm going to have you flex your head forward and then backwards. Neutral. Yep. So his head's still a little bit forward in his posture. You see that? So here's your homework. Daryl, lift up with your traps. Lift up. Pull back with your rhomboid simultaneously. Flare these guys back like that. See how that trap increases your trap tightness right there?
Yes, sir.
Okay, now we want to bring your head straight back.
Oh,
Ow.
sorry.
Okay. Now look up at the ceiling. See how you've got his ear over your shoulder now? I'm going to tap your atlas right there. Right there. There we go. Okay. Now I want you to relax and flex your head forward and backwards again. That should have felt smoother than the previous one, did it?
Yes, sir.
Okay, take a look in the mirror right now. Look how we got equal spacing from side to side down your pelvis now. Go ahead and bend forward just a little bit and see if this feels any easier to bend forward. That's a huge improvement. Now backwards. I bet that's easier too.
Yeah.
Yep. So, you came in here with a pain level of 7 on your low back and your legs this morning, Daryl. How do you feel right now comparatively?
Way better. It's a big difference.
So has this been the thing that's relieved your pain the most for your herniated disc so far
Yes,
in the
sir.
treatments that you've had?
Yeah,
Very
definitely.
good. Have you seen other chiropractors as
No,
well?
sir.
Just the orthopedic surgeon? Did he inject you yet?
No.
Yeah. Okay, do you want to?
Yeah.
Epidural steroid injection?
Yes.
So if you're looking to avoid epidural steroid injections or surgery, unless you have bladder or bowel dysfunction, if you have bladder or bowel dysfunction, you should go talk to a neurosurgeon or orthopedic surgeon that specializes in spine surgery. And we do refer our patients out who need that. However, there are some cases like Daryl's who oftentimes really won't have to get to surgery and can get fixed conservatively, like we're going to recommend that we do with Daryl here, and I'm sure he already feels the difference. So thank you for sharing your story with everybody. This is your Houston chiropractor, Dr. Gregory Johnson at Advanced Chiropractic Relief in Houston, Texas. And if you've got a herniated disc, we'll be seeing you soon. Talk to you later.